Good day. I will be reporting about Eikenella. Eikenella corrodens is a fastidious gram-negative facultative anaerobic bacillus. When we say facultative anaerobic, it is an aerobe that can grow in the absence of oxygen. Now, let me discuss to you about the history of the Eikenella. Eikenella, it was first isolated by Henriksen in 1948 and was first classified by bacterioid corrodents by Eiken in 1958. In 1972, Jackson and Goodman renamed it Eikenella corrodens to avoid mixing up with bacteroides Urolyticus. Eikenella corrodens exists in colonies that typically release a musty or bleachy smell. It grows at temperature from 35 to 37 degree Celsius. Its strain type is 80cc 23834 DSM 8340. So, Eikenella corrodens is a fastidious gram-negative rods which requires carbon dioxide for growth. Many isolates from pits in agar during growth and solid medium. Excuse me. Common characteristic is normal flora of oral and bowel cavities, often mixed with other flora, especially streptococcus. Common cause of infection after trauma, human bites or bites. It is a very common cause of infection after human bite. So, two people get into a fist fight and one person bites another person. Because Eikenella corrodens is a normal flora in the oral cavity, it can get into that bite and cause an infection, especially in individuals that are immunocompromised. Clenched fist wound infection with predisposing condition is a common cause. Also after dental manipulation and surgery. Eikenella corrodens is part of a gingival and bowel flora in 40 to 70% of humans, and it may be found in mixed flora infection associated with contamination of these sites. It occurs frequently in infections from human bites. Eikenella is resistant to clindamycin but susceptible to ampicillin and third generation of cephalosporin. So this is the illustration of Eikenella corrodens. Eikenella features. So approximately 45% of the isolates will pit or corrode the surface of agar. Other bleach. Always remember that we never smell our plates, do not sniff plates, but any characteristic odor is a differentiation feature. And then it is non-motile, oxidase positive, non-saccharolytic, it does not ferment, it does not utilize sugar in the presence or the absence of oxygen. And this is similar to the Moraxella organism. Similar to Moraxella. Eikenella is a catalase negative, often produce yellow pigment. So as you can see in this picture illustration, it's produce a yellow pigment. Next, under a microscope, one can see three different regions of Eikenella corrodens. First is a clear and moist center, a visible ring that appears as droplet, and an outer growth ring. A unique feature of this bacterium is that it is capable of corroding agar plate culture, hence the species names corrode. So this is the illustration of Eikenella corrodon, which has a clear and moist center, visible ring, appears like a droplet, and outer and growth of the outer ring. So Eikenella corrodans does not grow well in liquid media. Broth supplement with 0.2% agar, cholesterol with 10 mg per liter, and 3% serum can promote its growth under anaerobic conditions. 5 to 10% bile can inhibit growth. However, under anaerobic conditions, up to 10% bile can be tolerated. So, in this illustration, Eikenella corrodans in chocolate agar after 36 hours. So, notice that there is a colony pit, the agar, which is distinct characteristic of the species. So, here. So, colonies are small and grayish. Older colonies may become light yellow, produce a slight greenish discoloration in the blood agar, and elaborate color resembling that of bleach or the hypochlorite. Also, we can use blood agar into the Eikenella corrodans. About half produce the pitting or corroding of the agar that is considered characteristic. The organism grows poorly in Makonki agar, so it is not applicable to Makonki agar because it grows slowly. Strains do not form acid from carbohydrates, are oxidase positive, catalase negative. Few strains are weakly catalase positive, urease negative and indole negative, and reduce nitrate to nitrate. So other common clinical manifestations include respiratory tract infections and human bite infection, clenched fist as what I have explained before, and infections among chronic finger and nail bitters. Eikenella has also caused infection in insulin-requiring diabetic patients and drug-abusing skin poppers who lick their needles and necrotizing fasciitis after elective hernia repair. Severe soft tissue infection, with or without underlying osteomyelitis, may be slow to resolve. Suppuration due to Eikenella infection is full smelling, mimicking, and an aerobic process. It also a pulmonary infection including em- empyema, pneumonia, and septic emboli, in conjunction with internal jugular vein thrombosis, can occur typically in the patient with underlying chronic illness or intrathoracic malignancies. So, Eikenella corrodans is biochemically inactive. It does not ferment glucose and other carbohydrates or produce acid. It tests negative for catalase, urease, arginine, hydrogenase, and indole, but is positive for nitrate reduction as well as oxidase and lysine decarboxylase. Eikenella corrodans infection are typically indolent. The infection does not become clinically evident until a week or more after the injury. They also mimic an aerobic infection, being extremely foul-smelling, so it can be so mabaho. So that's all for the Eikenella corrodans. Thank you for listening.